Welcome once again to Dental XP. I'm Dr. Maurice Salama, and today we're going to be taking you through a case which many of you probably do in your clinical practices. Extraction of tooth number 13 was performed 3 to 4 months prior to this video and grafted with Puros particulate allograftic mineralized bone. And we came back in approximately 4 months and placed an implant into this staged site. And what you're going to see is the process of bone expansion, utilizing stoma expanders, and also the process of evaluating the site utilizing bone sounding of the bone, making sure that we have enough bone, and trying to do this in a minimally invasive fashion. Here what you're seeing is us bone sounding on the mesial aspect of the first molar and the distal of the first bicuspid, as well as the buccal aspect, making sure that we have intact areas of bone to work with. We then utilize a punch technique. This is a surgical tray from stoma that allows us to remove just the amount of soft tissue of the bone that's needed in combination with ridge condensers or bone condensers. So simultaneously we start the process of condensing the bone utilizing these bone condensers and mallets, and then once we're comfortable with the direction of the bone condensers, we then attach these tissue punches to the condensers and remove the soft tissue from the crest of the ridge. And this is what you're seeing here as I'm going in with the angled condensers because of the posterior area, and I'm just pressing and rotating with my wrist in order to remove the excess soft tissue from the crest of the ridge. Once I do this, you'll see it's very easy for us with a tissue pickup to remove that tissue from the crest of the bone. Now we have access to the underlying bony crest. This instrument allows us to enter into that osteotome site and to make sure that we're 1.5 millimeters from the adjacent teeth. And when I rotate this caliper, it also lets me know that I'm 1.5 millimeters from the extent of the buccal tissue. That's about where I want to be with implant placement, especially when the idea is to make this as efficient and as simple as possible for the future restorative procedures. We're now going to go ahead and use the bone condensers to condense and compact the bone rather than drill it away. This allows us to get good bone quality around the future implant, allowing us to potentially place the implant and temporize simultaneously. Today we're going to be utilizing a Unibody, a one-piece implant from Zimmer Dental, and this is going to be a 3.7 by 11.5 millimeter long Unibody implant. And we're going to go ahead and prepare this site to accept the placement of this implant, and hopefully at a very high initial torque insertion value. We're now going up in levels of the osteotomes. This is a 2.7 by 3.2, so I'm slowly expanding it, and once I get up to the 3.2 to 3.7 that you're seeing here to expand this ridge and condense the bone starts to get very, very dense. It's hard to get down to the final area, and at this point, since I'm going to have to place my implant, I don't want to have to over torque the Unibody implant. I will first go ahead and utilize the bone tap that comes with this implant system. This is the implant tray from Zimmer for the Unibody implant, and this is the carrier assembly utilized to place the Unibody fixture. Very exciting about this implant versus others is it's a pre-contoured implant with an anatomic flare and contour to the implant. We'll go into that in just a moment. First, I'm going to go ahead and use my bone tap, make sure that the threads have been tapped in this now dense bone to allow us to insert the implant without overstressing, over torquing. As you see, as I'm taking this out, look at all the bone that comes out on the bone tap due to the condensing process. I'm going to go ahead now, and as you can see, this Unibody implant from Zimmer has a higher aspect on the palatal and a lower aspect on the facial, allowing for a more anatomical contour to this Unibody implant abutment. And I have to make certain when placing this implant that I secure that the buccal aspect is in fact towards the buccal. You'll see there's 2 prongs now on the buccal aspect that have to be facing mesial and distally for us to make sure that we're on the buccal aspect. This is an analog with an impression coping that snaps on, which makes the restorative phase very simple. You'll see it snaps right into place subgingivally, and this impression snap-on coping now has undercuts that allow us to take an immediate impression and to secure that impression in these undercuts so the snap-on component can then be removed. So at the day of surgery, the implant goes in and an impression is taken for final restoration and an immediate temporary. The analog here, the white analog, is snapped into the impression tray, and this now becomes the working model for the temporary, immediate temporary restoration, as well as the final restoration that will be seen in approximately 8 weeks. I now will go ahead and utilize a temp-based cap or snap-on coping for an immediate temporary, just simply utilizing a polycarbonate crown and some acrylic reline material. Approximately 5 minutes, I take this on and off, making sure that it does not lock into place, and then remove it, and I can retrofill the areas around this temporary cap in the laboratory or chairside. In our office, since we have a laboratory, we'll go ahead and do this in the lab, and you can see the margins are sealed utilizing the temporary coping. We'll go ahead and paint on composite resin and use a flowable composite resin to seal the temporary restoration out of the mouth. Just to give you an idea of how this fits and works, the snap-on component then snaps into place, and we can use the analog to seal the temporary outside the mouth, which makes it much easier for us. And you can see this is the day of surgery, no bleeding, no hemorrhage, and very little discomfort to the patient. We're now going to cement this temporary restoration utilizing an antibiotic ointment called acromycin, so that there's no cement that is forced into place subgingivally. We make certain that there's no contact and centric occlusion, and that this temporary restoration is not loaded. The patient goes away in approximately 2 months. The work in the lab is now ready for final insertion of the permanent crown. So the patient has only had to go through 1 sitting, and the final crown is ready the next time that we see her in approximately 8 weeks. And this is the final ceramic crown taken. You can see how the soft tissue is healed. We check to make sure that it goes down. The contacts are not overly tight. We check the occlusion and the fit. And we make certain that we don't have a high spot on the implant crown. We check this in both centric and in lateral excursive movements. Contacts are checked as well with floss. And of course, we can then check on the margins that are sealed, that there's no open ledges or gaps. And approximately 8 weeks later, what you're looking at is the final crown, the day of insertion and cementation. So a very efficient process to secure the restoration of a dentural span utilizing a unibody implant. Thank you for your attention.